So your doctor just handed you a prescription for Wellbutrin, and your brain's spinning a little. Wait, isn't this one that doesn't really work on serotonin? Is this going to make me feel awake and alive or wired and anxious? And why Wellbutrin instead of something more common like Zoloft or Lexapro? Let's talk about it. I'm Dr. David Danish. I'm a double board certified psychiatrist, and I prescribe Wellbutrin to thousands of patients. In the right patients, it can be a total game changer. But in the wrong ones, it can cause more harm than good. I'll walk you through what it's meant to do, what real-world side effects look like, and most importantly, how to know if it's the right fit for you. Let's dive in. What it's supposed to do. Wellbutrin, also known as bupropion, is a bit of a unicorn in the antidepressant world. Unlike most antidepressants, which boost serotonin, sometimes norepinephrine, Wellbutrin works primarily on dopamine and norepinephrine, the brain's chemicals tied to energy, motivation, attention, and drive. It's FDA approved for major depressive disorder, as well as seasonal affective disorder. It's also got an approval for smoking cessation under the brand Zyban. It's the same active ingredient. But it's also commonly used off-label for many conditions: adult ADHD, low motivation or apathy, especially when SSRIs are not helping enough, reversing sexual side effects from other antidepressants, including SSRIs, and weight management. It's part of a drug combination called Contrave. When does it start working? Some patients notice more energy, better sleep, or improved focus in the first 1 to 2 weeks. But the full mood lift, that can take 4 to 6 weeks or more. Why is this? A major active metabolite, hydroxybupropion, builds up slowly in your system and likely does the heavy lifting for mood improvement over time. A lot of patients describe the shift like this: I didn't feel heavily drugged, and I finally could get out of bed more easily. I felt like doing more things. It was just easier. That's the sweet spot. Side effects and red flags. Let's get real about what can go wrong and what usually doesn't. More common early side effects seen in up to a quarter of patients: headache, dry mouth, nausea, jitteriness, trouble sleeping, especially if taken too late in the day or towards bedtime. Stuff that can linger or get worse over time: insomnia, especially with the later dosing, and heightened anxiety, especially if ramped up too fast as a dose. But on the flip side, it rarely causes weight gain or sexual side effects. In fact, it often improves both when used alongside an SSRI. Red flags: this is when you call your provider if you notice worsening irritability, agitation, impulsiveness, increased emotional distress, or high anxiety, and especially suicidal thoughts, especially in the early going on this medication. Like any antidepressant, there is the 1 in 132 chance of having increased suicidal thinking when you start an antidepressant. This is a black box warning on all antidepressants for patients under the age of 25. Another warning about this medication from early studies is it should not be used in patients who are prone to seizures, especially also in patients who have a history of eating disorders or heavy alcohol use, or those in benzodiazepine withdrawal. Allergic reactions are rare, but they still need to be watched for. If there's any trouble breathing or a diffuse rash after taking it early on, go to the ER immediately. Any eye pain or vision changes, extremely rare, stop it and go to the ER. Dose ranges and formulations. There are a few different formulations of Wellbutrin, but here's what I usually use. Wellbutrin XL, which is extended release, once daily dosing. It's easier to stick to. I start at the lowest dose of 150 milligrams every morning. It's often increased to 300 milligrams a day, and the max is 450 milligrams a day, but that's more rarely needed. Morning is always best in terms of taking this. Otherwise, if you take it too late in the day and it energizes you, you're not going to sleep as well. It's sometimes used for ADHD or smoking cessation. Again, you're still taking it in the morning. Always start low and go slow to avoid side effects. Here's my take on Wellbutrin. Here's what I usually tell my patients. Wellbutrin's like a jumper cable for the brain. In the right engine, it sparks up motivation, energy, and drive. But if the battery's already overloaded or wired differently, it can short circuit things with anxiety or irritability. It shines for people who say, I'm flat, I'm tired, nothing motivates me. SSRIs helped a little, but I still feel stuck. I can't focus, and I'm always dragging. It's also one of the safer antidepressants for bipolar depression But let's be clear, no antidepressant is 100% safe in bipolar disorder. There's always a small risk of triggering mania. I'm cautious with anyone prone to panic, agitation, or intense anxiety if I'm considering Wellbutrin, because Wellbutrin can make that worse. Bonus tip, when we combine Wellbutrin with Remeron, which is taken at night, it's been nicknamed California rocket fuel because the way they complement each other on different neurotransmitter systems can really lift people out of stuck, low energy states. If you're starting Wellbutrin or thinking about it, don't go it alone. I've created 2 free resources to help. You can grab both at drdaviddanish.com. And hey, if this video helped you, chances are it'll help someone else too. Share it, please. That small gesture might make a huge difference in someone else's life. Medication journeys can feel uncertain, but the right one, it can change everything. You've got this.